Good afternoon, Professor Freeman. Pleased to meet you.
Good afternoon.
Could you please explain us what you do at EBMA and how you got involved in our project?
Okay, so the European Board of Medical Assessors, EBMA, was a project that began in development some 7 years ago. And it is a not-for-profit organization, and it offers expertise in best practice in assessment in medical education. The organization has several principal members, most of whom are undergraduate medical schools across Europe, and also individuals who express an interest in it. We offer mainly advice about assessment using our expertise from our group. We also have assessment products, various tests such as progress testing, computer adaptive testing and so forth, knowledge-based testing, which we can offer to anybody who's interested. And in fact, most of our members do take up that offer. But then we were approached a little while back by Practicum, asking if using our resources of expertise we could audit the Practicum product, which we duly did, and we found that it was a very good product. We were very happy to make a few small suggestions about development, but overall we thought it was a very good form of learning and assessment for individual doctors. And now we're working with you to see if the Practicum system tool can be adapted to work in undergraduate medical education as well as postgraduate. Okay.
Actually, I was going to ask you about this application of Practicum Script to graduate students. What can you tell us about it? What are you working on specifically right now?
So what's happening is that Eduardo has submitted an outline for us to look at, and the aim is to present this to our member institutions when we have our annual conference on assessment, which will be in Braga in Portugal in November. So that's one of the functions we do. We have an annual conference on matters associated with academic matters associated with assessment. And as you may know, we've also just had a very successful conference specifically in the area of progress testing.
Mm-hmm. Your particular interest is in assessments in education. So what are the main challenges in this field? I mean, regarding or in relation to medical competence and CVs?
Well, the main challenge, as I talked at the conference, is time. Things are moving really very fast. I've talked about the fact that medical knowledge, the doubling rate, i.e. how long it takes for the total body of medical knowledge to double, within 2 years that'll be down to about every 2 months it'll double. We've got the onset of artificial intelligence and how that's moving into medicine. We've got the advance of technology. We've got the advances in genomics. And basically it's all happening very, very quickly and as we say, exponentially. And so assessments have to be much more flexible, and the traditional undergraduate model of a 5 years course and then a final exam at the end is inappropriate, and it's going to be, you know, that's the main challenge, is that we've got to be much more flexible with our assessments, much more sensitive to the needs of the current doctors and to the future doctors as well.
Okay. You just mentioned this Exeter encounter, this meeting you hosted. What's your opinion about tools not only designed to measure knowledge, but also the way we learn?
Yeah, so I think one of the things I talk about is that actually the assessments shouldn't just be of learning, but should be for learning. And so the assessment should give feedback to the students, the delegates, whatever, about where they are and about how they're progressing and about ways that they can identify gaps in their knowledge. But also not just knowledge, but particularly the concept of clinical reasoning and how we as doctors reach conclusions and what processes we use, and also to some degree, well, not to some degree, but also clinical skills and how we develop our clinical skills and specific competencies. Yeah.
Mm-hmm. How can clinical reasoning training benefit intuition and
Okay.
experience?
Yeah, fine. I think that if you look at some of the data that's around, sometimes relying on experience and intuition may not be helpful. And we are going to have considerable challenge with more complex medicine because of comorbidity and so forth.
Mm-hmm.
And in those situations, our decisions really have to be evidence-based as best we can. But that doesn't mean that we have to stick to rigid, what we call algorithms or pathways. And as doctors, our strength should be that our education has been such that we can adapt outside of those algorithms if necessary. So that's going to be our possible way that we would augment the future of artificial intelligence in medicine. So I think clinical reasoning it's really about us as doctors having an understanding of the mechanisms that we're using to reach those reasons, reach those conclusions, and of the tools that we can use, and the importance of constantly refreshing our medical abilities in the light of the rapid developments that are going on.
Mm-hmm. Okay. And just one more question. I can see from your CV, from your profile, that you've developed overseas training programs in lots of different countries, like Dubai, Oman, China, but lots of them. And you've also delivered teaching courses in Indonesia, Canada, among others. How important is it to export knowledge in this global world?
Well, the simple thing is that the globe is shrinking, that the world is getting smaller, and particularly with easier travel. And some of the work I've done in the past has been about what is common core knowledge, what are common clinical skills. And the conclusions that I and others have had is that about 80% of knowledge is common across different cultures and different countries, different health systems. There still remains a 20% that's is just local to the health needs of that particular country or culture, or to the systems of delivering health in that particular country or culture. But 80%, yeah, it's it's really important that we think global, that we engage in education globally, and that's one of the reasons for the existence of the EBMA.
Many, many thanks. It's been a pleasure talking to you.